New data from the CDC shows a troubling jump in the number of patients with COVID, flu, and RSV, all needing to be hospitalized.
CBS News correspondent Danya Bacchus has more on how you can try to keep your family healthy.
As we spend more time indoors, cases of COVID, flu, and RSV are rising.
Indoor environments, particularly in the winter, tend to be a little bit lower humidity, and that's been shown to help transmit some respiratory viruses.
Dr. Andrew Bacchus is a virologist at Johns Hopkins Bloomberg School of Public Health. Data shows over the past several weeks, hospitalizations rose 200% for the flu, 51% for COVID-19, and 60% for RSV.
While we're seeing increases in influenza in particular at this time of year, they're not as severe as they were last year. And when we dig down deep at the viruses that are circulating right now, they all seem to be pretty good matches for the viruses that are in the vaccine.
But vaccination rates are lagging. The CDC issued an advisory that low vaccination rates against flu, COVID, and RSV with increasing cases could lead to more severe disease and strain on the healthcare system. Another thing we can all do to help prevent the spread of these viruses, pay attention to symptoms and stay at home if sick. Dr. Bacchus says testing is also critical and needs to be done early after symptoms.
We have to deal with these respiratory infections every year. We shouldn't ignore them, but we have a lot of tools to be better prepared to deal with them, whether they be vaccines ahead of time, the extended testing that we can do right now for viruses, and the availability of antivirals.
He says using these tools can minimize the impact of these infections and keep more people safe. Danya Bacchus, CBS News, Los Angeles.